Hi, Dr. Raja. This is Lana, and this is my mom, Mrs. Franklin, and she will be helping me out today with some goniometric exercises. So, if you could go ahead and place your forearm over your chest, like so. So first we're going to measure hip flexion, and it would normally be a soft end feel with a measurement of 120 degrees is normal. So I'm going to place the fulcrum. First I'm going to palpate for her greater trochanter, which is right here. The fixed end of the fulcrum is going to be on the lateral side of her torso, and the moving end is going to be on her femur. So if you could for me, please bring your knee towards your chest. Thank you. No, stop right there. Thank you. She is at about 120 degrees. Go ahead and lower your leg. Next, we're going to be testing for her hip adduction. So go ahead and relax, and I'll be moving your right leg out a little bit. Relax. And I'll be moving your left leg in a little bit. I'm going to palpate for her ASISs. And normally I would be on a harder surface, so she wouldn't be tilting her body as much, because I want her toes pointed up and I want her pelvis level. But I'll be palpating for her ASIS, where the fixed end of the goniometer is going. The fulcrum is at the ASIS of the limb I am testing, and the movable end is midline of the femur. And I'm looking for about 20 degrees of movement. I'll be subtracting the 19, so thank you. She is at about 15 degrees. I'm going to be bringing your legs back to midline, Mrs. Franklin. And now, next I will be testing abduction. And the non-movable end of the goniometer would be along the two ASISs. And the movable end will be along midline of the femur, so towards the patella. And the fulcrum is at the ASIS I am testing. And I am looking for 40 degrees is normal. So go ahead and relax your left leg, and I'll be moving it. So we are at about 42 degrees of movement, and that's a soft end feel. Adduction is also, actually, abduction and adduction are both firm end feels. Okay. All right, Mom. So next, let's sit you up. So you're sitting at the edge of the bed.
Okay, this way?
Yep, towards me.
Okay.
Thank you. And next I'll be measuring some internal and external rotation, which means I'll be measuring which way your ankle goes inward and outward.
Okay.
How do you feel? Are you comfortable?
Fine.
All right.
Thanks for asking.
Let me get a rag or a towel to put under your leg that I'll be testing. This is to ensure her leg hangs freely. So the fixed end will be here, pointed downward from the patella, and the moving end will be on the tibia. So go ahead and relax. And I'm looking for a soft end feel here. So I'm at around 15 degrees in IR, and the normal is around 40 degrees. Okay, next I will be testing her external rotation. The fulcrum will be like internal rotation down from the patella, and the moving arm will be along with the tibia, and the stationary arm will be perpendicular from patella. So go ahead and relax. I'll be moving you more. So she is at about 20 degrees, and that would be also a firm end feel. Both ER and IR are a firm end feel. So go ahead and lie on your tummy for me. There's
Which
one
way?
more head this way, and whichever is comfortable. Here's your little pillowcase.
Okay.
So next I'll be testing hip extension. And Mom, is it okay if I put, Mrs. Franklin, is it okay if I put a pillow under your stomach?
I guess so.
It's more comfortable.
Fine.
Try to think. And so I will be testing her hip extension now. The fulcrum will be at her greater trochanter. And the stationary arm is the lateral midline of pelvis. And the moving arm is lateral epicondyle. The end feel will be firm, and the normal degree of extension is 20 degrees. So I'm going to palpate for the greater trochanter right there. Can you go ahead and lift your right leg up and try to keep your hip to the table? Thank you. Hip to the table, please. Thank you. So go ahead, lift up. All right, so she is at around 5 degrees. All right, thanks, Mom.
Okay.
Okay, now we're going to be doing some muscle testing. Mrs. Franklin, if you would please lay on your side, facing me. Thank you. Would you like a pillow?
No.
Okay, go ahead, lay down on your side. Go ahead. Straighten out your legs as much as possible. Can you scoot towards the edge of the bed, please? Further. Alright. First, we're going to test your glute minimus. So I'm going to lift up your leg. I'm going to tilt in internal rotation with slight hip flexion. I'm going to make sure her pelvis. Alright. And she's going to resist adduction and slight flexion. Okay? Are you ready? Try to resist my movement. Alright, nice. Go ahead, relax. I would give that a grade 5. Now we're going to do glute medius. So I'm going to put her in a position of abduction and then external rotation with her hip and knee in extension. And she is going to resist adduction and slight flexion. Okay. When I push, start resisting me, okay? Let's keep your pelvis up. There we go. Thank you. Okay. I would say that is good. Alright. Thanks, Mom. Good, that was good. Good job. Okay, now we're going to test her psoas. So to test her psoas, her iliac psoas, I'm going to raise her leg up, her hip into flexion. I'm going to abduct it slightly and do some slight external rotation. And she is going to resist me as I try to extend her hip and abduct it. All right, ready, Mom? Okay, go ahead and resist. And okay, I would say that's normal. She had some compensation on her right leg. It's hard to tell with the bed what's going on. And then next we're going to test her TFL. And I just made a mistake. I should have put my hand on her opposing ASIS instead of the same leg. All right, next we're going to test your tensor fascia lata, Mom. So I'm going to position her leg and position her hip in flexion, slight abduction, and slight IR. So I have to be careful because she has a wound on her ankle. All right, Mom. So try to resist me, okay? She's gonna resist me in extending her hip and adducting her hip. So I would say that is normal. Thank you. So now I'm going to walk through what I would do if I were to test her adductor. So could you please turn and face me? Turn onto your left side. Thank you. Because of the dip in the bed, I can't really test the adductors well. She wouldn't even lift her bottom leg off the bed, but I'll walk through it. So I would raise her upper leg and I would raise the bottom leg and I would have her resist me trying to abduct her leg. So I would press just above the knee. So she would be resisting abduction. Okay, go ahead. Okay. So if you could please lay on your stomach for me. Now I'm going to test her glute max, her right glute max. So I'm going to bring this leg up. And are you comfortable?
Sure, honey.
Do you have any limitations?
No, honey.
Okay. So I'm going to lift this leg up. And again, it's very hard on the bed because there's a dip where her torso is. And I would lift this leg up and she would resist my right hand pushing down on her posterior thigh. So she would resist hip flexion. So resist, resist, resist. All right, thank you. And I can't tell what grade she is because of the bed, but that's the direction she would resist in. Now we're going to look at her sartorius. So Mom, could you please roll over onto your back, please? There we go. Okay. Can you please lay your legs flat? So I'm going to put her in a position where her knee and hip are flexed at 90 degrees. And can you relax, please? Thank you. Relax, relax. Thank you. I'm going to put my left hand above her knee and my right hand at her calf. And she's going to resist me in extending her hip, adducting her hip, and internally rotating her hip. Good. Thank you. Relax. Relax. Okay. I would say that's normal. Now I'm going to test her reflexes. Let's start. We're going to do with her left leg. We're going to start with the flexor hallucis longus muscle. It's 0. 0. We're going to do the Achilles. That was hypoactive. Next we're going to do the patella. If you could please go like this for me. I'm going to palpate in between the tibia and the toe. That would be 2 plus normal. If you could please lay on your stomach for me. Your head that way. And please relax as I do this. Relax, relax, relax. I'm going to test her medial hamstring. Relax, please. Normal, 2 plus. And now her lateral hamstring. Normal, 2 plus. Now please turn over and lay on your back for me. I'm going to do her Babinski. This is absent. I'm going to do Clonus. Absent. Okay, that was her reflexes. Thanks, Dr. Raja.